Namaste, everyone. Today, I am talking about the otosclerosis. This is one of the most important exam topics in MBBS ENT and MSc ENT exam. Let's go the definition. Definition-wise is the localized hereditary disease, where this is in the aortic capsule. There, what happens is normal bone is replaced by oven bone. Oven bone, what are the character of the oven bone? Is increased thickness, or the increased vascularity, and increased cellularity. These three terms we have to know: cellularity, thickness, and vascularity. Site is already that is bony labyrinth in aortic capsule. What are the layer involved? It involves endochondral layer. Remember this one. Common site, you have to remember fistula anti-anastrum. Okay, anterior to the oval window. Not this is not a fistula. This is a fistula. You have come with fistula. What are the etiology cause otosclerosis? One given is genetic basis. It is autosomal dominant with incomplete penitence. Okay, this is the genetic basis. Common in white races. Female more than male. Age group 15 to 35. What aggravate it? It aggravate in pregnancy. Look here. It is associated with osteogenesis imperfecta, also called Van der Hoef syndrome. There is a Van der Hoef syndrome, which is a variant of osteogenesis imperfecta. What are the character in the Y? Y means osteogenesis imperfecta. There is a blue scrap, there is a hearing loss, and osteoporosis with bone fragility. There is a question coming with this kind of osteoporosis and so much bone fragility. There is a multiple fracture in the womb of the baby. Okay, this kind of baby occur in the this kind of side in osteogenesis imperfecta. This case also there is a chance of otosclerosis expression. Viral link. Somebody asks viral link, then you have to answer from with measles virus. What are the type? There are stapedial type. It is occur in the stapedial foot. Sometimes it occurs in the cochlea. Okay, this is a cochlear type. Sometimes we got when histological examination is done. That is histological type. Stapedial involve stapes foot plate. Stapes foot plate. You know there is a stapes foot plate where this disease occurs. This is the stapes foot plate. This is the superstructure here. You can see disease involved here. Maybe anterior cura or posterior cura. Histological, you can see only microscope. There is no hearing loss, nothing. Okay, it can see only microscope examination. Subtype, there's so many subtype they are given. Just remember anterior, posterior, circumferential type, maybe biscuit type or obliterate type. Okay, anterior means it more occur in this area. Okay, anterior cura. If posterior, posterior cura. Biscuit type means occur everywhere here. Here. Okay. Circumferential means only periphery region. This way periphery. Obliterate is obliterate. Okay. This way there is subtype also given. Pathology wise, grossly there is a spongy vascular bone which is occur in the oval window. Near active focus occur vascular soft. This is spongy bone which is otospongosis. Okay, mature bone also there. This is a sclerotic bone. This is otosclerosis. So you have to come with active otospongosis, mature otosclerosis. Blue mantle zone of basophilic immature bone. This is called blue mantle. Symptom-wise, most common symptom is progressive conductive hearing loss. There is a conductive hearing loss. Some patient complain with tinnitus, which is a low pitch. Other term is para-acoustic wheelchair. This is commonly asked in the Viva. This is better here in noisy places like flea mall, like crowd. You can this kind of patient listen well. But I go rare and speech soft spoken people hear own voice loudly, so they are soft spoke. Sign tympanic membrane. What are the finding in the tympanic membrane? It's normal. Okay. Sometimes it's on pinkish, but most of the time it's normal, till the normal pass. Then somebody asks a Schwarz sign, then this is a pinkish hue you can see in the tympanic membrane. That is Schwarz sign. Station tube, also normal. Tuning for taste, RNA negative, Weber lateralized to the affected ear. ABC sometime reduce, sometime not. Okay. Carhart knows there is a deep in 2K hertz in bone conductive hearing loss. Okay, bony conduction. Carhart notes in deep at 2 kilohertz in bone conduction curve. After surgery, Carhart notes disappear. Audiometry, most of the time you can get a conductive hearing loss. Sometimes we see the mix also if there is a cochlea involved. Stapedial reflex absent. Here, also there is a AS type of curve in the impedance audio. AS type in the impedance audiometry. Treatment, medical treatment, sodium fluoride in active phase of disease we can give, but it is only literature. Most of the time go the surgical treatment. That is two type of surgery here: stapedectomy or stapedectomy. Most common type is stapedectomy. What are the instrument? It can be used cold instrument or laser, microdrill. These are the instruments we can use to make the fenestration in the stapes foot plate. Prosthesis, yes, Teflon is common one. Then titanium, gold also. Sometime it can be used. Indication: you have to look the cochlear reserve. Okay, cochlear reserve means there should be normal hearing, sensorineural hearing should be normal there. This type of get better with this kind of treatment. Contraindication: if there is single ear, there is active infection, and most important, I think, poor cochlear reserve, we can't do. There is no benefit doing the stapedectomy or medical treatment, any kind of treatment. Pregnancy, yes, other also there is a contraindication. Complication: some patient develop vertigo after surgery. Some patient also show taste disturbance. Yeah, tympanic membrane perforation sometimes perigusser leak also described in the literature. In the early phases, late phases, there is a sensorineural hearing loss, also perilymphatic fistula and dead ear also described. Prognosis, success rate 90%, around 90-95%. Hearing aid, these are given patients who are unfit, unwilling to surgery, unfit to the surgery, or they are not don't want the surgery. That time we can prescribe, we can give the patient with hearing aid.